addiction. Governor Scott Walker says the name of the game here is to get Medicaid recipients, here in Wisconsin it's called Badger Care, but to get those recipients into the workforce where they will likely be required to pass a drug test.
Most of us believe that public assistance should be more like a trampoline than like a hammock. And really, for those who are able to work, we should enable them to get back in the workforce.
Now, opponents argue that the poor are being singled out. You end up spending money on drug testing instead of treatment, and you get arguments that it won't discourage drug use. It will discourage people from getting help for their medical problems.
We think this would be a big step backwards because it approaches drug addiction as a moral failing rather than as a disease.
However, a key element to Walker's proposal is that someone who tests positive for drugs automatically gets rolled into a drug addiction treatment program at taxpayer expense. The only people refused a public health benefit are those who refuse to be drug tested. Now, the measure would need to be approved by the Trump administration. It'll be sent to Washington in the early part of next week. It also needs to pass the state legislature as a part of the overall state budget. That will happen later this summer, and a court challenge is expected. Heather?
All right, Mike Tobin live for us. Thank you, Mike.